First, always assess the scene. Check your surroundings to make sure it's safe for you, the rescuer, and the victim. Remove any obstacles or hazards in the immediate area, such as personal belongings, debris, or small furniture. Next, determine if the victim is experiencing cardiac arrest. Start by checking for responsiveness, gently tap and ask if they are okay. Look for breathing. If there is no normal breathing, only gasping, or if you cannot detect a pulse within 10 seconds, assume cardiac arrest. You should check for a pulse and breathing simultaneously to save time. Once you recognize cardiac arrest, activate the emergency response system. If you are alone without a phone, leave the victim temporarily to find help and retrieve an AED, then return to begin CPR. If others are present, ask someone to call for help and find an AED while you start CPR immediately. Once the AED arrives, use it as soon as possible. If you are providing CPR alone or with one other person, perform 30 chest compressions followed by 2 breaths. With an advanced airway in place, maintain a steady rate of chest compressions at 100 to 120 per minute while providing 1 breath every 6 seconds, totaling about 10 breaths per minute. Keep your compression rate between 100 and 120 compressions per minute. Ensure each compression is at least 2 inches or 5 centimeters deep to be effective. Place both hands on the lower half of the victim's sternum or breastbone with your fingers interlocked and elbows straight. Allow the chest to fully recoil after each compression. Avoid leaning on the chest as this restricts full recoil, reducing the effectiveness of CPR. Try to minimize pauses in compressions to less than 10 seconds whenever possible. Lastly, avoid common CPR mistakes. Don't compress slower than 100 or faster than 120 compressions per minute. Ensure compressions are no shallower than 2 inches and no deeper than 2.4 inches. Don't lean on the chest during compressions. Avoid unnecessary interruptions longer than 10 seconds. And be careful not to overventilate, provide just the right amount of air, as too much force can harm the victim. With these CPR guidelines, you can help save lives by providing effective care until emergency medical services arrive. Remember, safety, quick recognition, activation of help, and quality CPR make all the difference. Stay prepared, stay informed, your knowledge saves lives.